What's going on, everyone? It's Alex here from Alex Physio. Today we're going to be going over 5 exercises for jumper's knee. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today we're going to be going over 5 exercises for jumper's knee or patellar tendinopathy. Just a brief overview on jumper's knee before we begin. It's basically a tendinopathy or an irritation of the tendon. Your patellar tendon is basically found just below your kneecap, and it connects via your quadriceps muscle onto your tibial tuberosity. This is this bony bump just below your kneecap. So your patellar tendon is a few centimeters long, and this tendon can be irritated with a lot of repetitive jumping, high intensity activities that irritate it because of the constant bending, straightening of the knee, especially when you go from not doing much activity to ramping up the level. This is a pathology that doesn't generally respond to just time. It's something that needs load and gradual progressive load in order to get better and for you to have less symptoms so that you can go back into sports. This is something that I actually had when I was in high school playing basketball, and it's something that was pretty debilitating for a few months. So I'm giving these exercises or creating this video in honor of my injury that I had when I was in high school to anybody who is experiencing this now, because I wish that I had access to this kind of information when I was in high school. So let's get into it. The first exercise we're going to do is just an isometric knee extension. Grab this chair. You don't need any equipment. You can just use your other leg. And basically what I'm trying to do is I'm trying to straighten my knee. So if my left patellar tendon is affected, I'm putting my right leg over my left leg, or the left lower aspect of my leg, and I'm just trying to straighten my leg against that resistance that my right leg is applying, okay? I'm just trying to hold that. And then you should feel the tension in the quadriceps muscle, and also you're loading up that tendon as you're pushing into that other leg. The nice thing about this is that it gets more challenging or easier just depending on how much load you apply or resistance you apply, counter pressure via the other leg. And then the also important thing with this is that you want to work in different ranges. So you don't want to only work when your knee is bent to 90. You also want to work on it when it's bent to 45, when it's bent to 30. So you're just trying to work on loading that tendon in different positions to try to improve the strength in different positions. So that's exercise 1, isometric knee extension. Exercise 2, we're going to do a goblet squat. So what this is going to look like is you're just going to grab a kettlebell or any dumbbell at the gym, feet hip width apart, toes pointed out slightly, and I'm just trying to think about sitting back into my heels until my knees are about 90 degrees, bent to about 90 degrees, and stand up tall. Okay, so I'm initiating the movement by pushing my bum back, chest up high, come down, and then pause. This exercise, the stage that you fall in is going to depend on obviously how provocative the symptoms are and where you are on the stage of recovery. It might be provocative just doing your body weight. By all means, start body weight and progress from there. That's exercise 2, the goblet squat. Exercise 3, we're going to do a wall sit. So this is another type of isometric. This is a closed kinetic chain exercise versus the isometric knee extension. And what that means is you're generating tension into the ground as you're loading your quads muscle and your tendon. So it's working the properties of the muscle and tendon in a little bit of a different way versus when you're doing the isometrics just in sitting. So the way this is going to work is you're going to bring your feet about hip width apart. You're going to sit down until your knees are about 90 degrees, and you're just trying to hold this position. Obviously, you're working both sides, so even though if you have jumper's knee on the left, you're still getting, you're working both effects, so you're working both sides, so it's not like you're biasing one over the other, but this is a good place to start. Just see how that feels on the tension. If you want to bring your feet out further, you're going to put a little bit less load on your quads. And if you come a little bit closer, so if you bring your heels closer to the wall, you're going to work your quads more. So just play around with the positioning. You can have one foot in front and one foot behind to load that tendon more and load it less on the right side. And the further you bring the right one out, the more the left is working. But this is just where you kind of play around with which movement or position feels appropriate or tolerable. It's okay to have a little bit of discomfort, but you don't want to push past the pain. So that's exercise 3, the wall sit. Exercise 4, we're going to do a reverse lunge. So what this is going to look like is you're going to, instead of taking a step forward, which sometimes tends to be a little bit more provocative for jumper's knee, like with a forward lunge, because you have to decelerate off of this leg to come back, so it can sometimes just be a little bit awkward. You're going to try to do a reverse lunge. So what this is going to look like is you're going to take a step back, and then you're bending both knees at the same time, and you're leaning your torso forward. So you're loading, in this case, the front leg, pushing off the front leg, coming back to start. And then for sake of symmetry, we're just gonna do it on both sides. So now we're gonna go on the left, which is the affected side. You're leaning forward to bias a little bit more your glute muscles, and go until both knees are bent, until the back knee touches the ground. Lean forward, push off that front leg, and you're accelerating back to the start, squeezing your bum muscles and driving through. That's exercise 4, the reverse lunge. Last exercise we're going to do is a step up to a high knee. So what this is going to look like, again, you'll be wearing shoes, not socks like me, or in your bare feet. You're going to start with one foot on the step, and you're going to lean your torso forward, and you're pushing off this leg. This leg is doing about 80 or 90% of the work. The foot that's on the ground, you're trying to minimize using push off or using your calf muscles to help with the movement. I would even recommend that you have your toes off on the foot that's on the bottom, just to try to bias a bit more on the leg that's on the step. You're leaning forward, you're pushing up tall, and then you're driving your knee up in the air, and then coming back down, nice and controlled. Same thing. So lean forward, bias a little bit more the glutes, push off this front leg, toes up on the bottom leg, drive, hold, and control coming back down. So one more time, lean forward, push off that front leg, drive, hold, come back down. Now if this is too challenging, doing it all in one motion, because obviously now we're working a little bit on the hip stability and the control, the motor control, then you can just start off by pushing off that front leg and coming together. Then as that gets easier, because again, this is going to mimic a lot of sport performance, like if you're going for a layup, right? You want to be in control and stable and strong on that one leg. You want to build up towards that. And then obviously as that gets easier, then you can start adding some weights that you can hold on to as well. Okay? So there you have it. We went over 5 exercises for jumper's knee or patellar tendinopathy. We went over the wall sit, we went over the goblet squat, we went over the reverse lunge, we went over the step up, and we went over the isometric knee extension as our first kind of early stage rehab exercise. Let me know what you thought about this video. Have you ever been diagnosed with jumper's knee, or are you currently have jumper's knee? Let me know what your experience has been like down below. What are some things that have worked for you? What are some things that haven't? I have another video where I actually go over how to apply a quick jumper's knee tape job. That's in my, you can check out my channel and I'll link down below for that video. Again, just not a solution, just something that can help with your overall recovery and from a symptom management perspective. But let me know what you thought about this video. If you did find value in my content, please consider checking out some of my other videos. I have almost 500 videos on various physio, exercise, and medical related topics. And until then, we'll see you in the next video. Thanks for watching.